messages from its legal aspects about the AIDS is easier than CPR, readily available on place with heavy people concentration where can be probably used one during 2 years, extended beyond healthcare professional personally to trained citizens. About the cardiopulmonary again. CPR, check responsibility, open airway. Again, you have here, I will show you the scheme of the CPR for treating is about the eight. You put the eight of the patient, start with the shock and continue. Okay, it's with automatically switch themselves on when the lid is opened. Attach pads to casual bare chest. First one is going to the chest, another is you can see is going downstairs about the apex of the heart. After that, it's going back, analyze the rhythm. Do not touch the victim because it's generated electric shock. Shock indicated, stand clear. And you, after that, is the patient don't come back. You start again with the CPR. Immediately, starting with 30 chest compression and 2 breathing to the patient. Okay, if the victim starts to breathing, normally place him in recovery position. This is the recovery position of the patient who is very important about to breathing. Okay, yes, in the case of the victim hypothermia, CPR should not be usually be abnormal after 20 minutes. In cases of persistent ventricular fibrillation, it is not indicated shock. Complication during CPR, we have the gastric distension, about often in the child, prevention, avoid lung protective while making the chest raise. Rib fracture is the very complication in the CPR. Prevention, correct hand position, do not remove hands from the chest wall, prevent dancing of the chest, gastric or another fluids aspiration, and we have aspiration pneumonia after that in the ICU. About the children, suffusation disease, laryngotracheal bronchitis is the group age 1 to 3 years viral origin, backing out, not sore throat, no special position, intercostal retraction, dysphonia or aphonia is the another about children. Epiglottis, 3 to 7 years, bacterial origin, air hunger, sitting position of the patient, small patient, severe sore throat, severe inspiration dyspnea with stridor, and this is the about the epiglottitis is very big percent of the mortality is to 10% of the mortality in this patient with epiglottitis because the lung is very big one. But situation transfer to the hospital where anesthesiology or intensivist is available as soon as possible. And because it's very important to, because the child, small child, first stopped breathing, after that stopping the working of the heart circulation, not a general practitioner. This patient is very important to go to the hospital because we must intubate it or starting breathing to the child, and must to know if you have child for the CPR. First in the child, we start with the breathing, mouth to mouth or with your back. After that, it's coming with chest compression. In the adults, we start 30 chest compression with the breathing to the patient. Okay, this is for today. I will send you all of the presentation from me. I will send you the conspect for the exam, and I will send you one Oxford handbook for the emergency medicine. Is the PDF file. I have the number about the students who call me before. And the next week, maybe if Dr. Dimitrov is don't have time, I will have a lecture with you, but I will call you if you like to ask you about the lecture or practical exercise. Do you have some question? And I will thank you. Okay, now in the Clement Medic's Gmail, I will send you the presentation and all materials about the exam. Okay. Okay. See you. Bye bye, friends. Have a good weekend. Don't go into the discotheque because the COVID-19 is come back. Stay home and be safe. Bye bye.